Hello everyone, hope you all are doing well. In today's video, we'll be talking about ECG changes in the potassium imbalance. We know that potassium is very important electrolyte. It helps the heart by generation of action potential. So what happens if potassium level is more or if potassium level is less, the electrical conduction system also gets affected and it is shown in the ECG also. So in today's class, I'll be covering about two main abnormalities which are hypokalemia एंड hyperkalemia. तो हम बात करेंगे आज डेफिनेशन डिग्री ऑफ बोथ ऑफ दिस कंडीशंस ईसीजी कैरेक्टरिस्टिक्स एंड मैनेजमेंट की एंड लेट्स स्टार्ट विद द हाइपोकैलेमिया फर्स्ट. हाइपोकैलेमिया मींस डिक्रीज इन द लेवल ऑफ पोटेशियम इन ब्लड. तो अगर पोटेशियम का लेवल कम हो जाता है ब्लड में हम उसे बोलते हैं हाइपोकैलेमिया. एंड कितना कम हो जाता है? लेस देन 3.5 मिलीमोल पर लीटर. In hypokalemia also we can have different degrees or different levels, like we can have mild hypokalemia, moderate hypokalemia or severe hypokalemia. In mild hypokalemia, the potassium level ranges between 3 to 3.4 millimole per liter. In moderate hypokalemia, the potassium level ranges between 2.5 to 2.9 millimole per liter. And in severe hypokalemia, the level ranges less than or equal to 2.4 millimole per liter. So depending on these levels, there can be prominency of the ECG changes. Like अगर patient को mild to moderate hypokalemia होगा, might be इतना अच्छे से आपको ECG changes नहीं दिखाई देंगे. But if a person will be having moderate to severe hypokalemia, there will be peculiar or prominency of the symptoms seen on the characteristics seen on the ECG graph paper. So कौन कौन सी characteristics होंगे? In a person who has hypokalemia, there can be increased P wave amplitude. जो P wave की height है, amplitude है, वो हल्की सी बढ़ जाएगी. There can be prolongation of the PR interval. PR interval का जो width है, it might increase. Like normal PR interval is between 0.20 to 0.12 to 0.20 seconds. But in case of hypokalemia, it can be more than 0.20 seconds. They can be ST depression or T wave flattening or the inversion. And also, very important feature, there can be the presence of prominent U wave. U wave दिखती है यहाँ पे and usually आपको precordial leads V2 और V3 में दिखती है. And because of this U wave, you'll be finding QU interval from Q, starting of the Q wave to the starting of the U wave. And this QU interval will be prolonged. It will be more than 0.45 seconds. So here you can see that if a person has hypokalemia, he can have slightly peaked P wave. He can have prolonged PR interval. They can be ST depression. They can be shallow or inverted or flat T wave. They can be prominent U wave seen. Here also we can see that here in this graph, you can see there is inversion of the T wave and presence of the U wave. Here you can see that you have the joining of P with the U leading to a QU interval, which is prolonged. So these things can be seen if a person has the hypokalemia. Now, how to manage? Again, the management will depend on the severity of the hypokalemia. अगर patient को mild hypokalemia है, he can advise to have the potassium rich food. वो डाइट जिसमें पोटेशियम अच्छे अमाउंट में है, द पर्सन कैन टेक इट एंड द हाइपोकैलेमिया कैन गेट रिजॉल्व बिकॉज ऑफ दैट. यू कैन एडवाइज अ पर्सन if he is having moderate hypokalemia to go for the syrup pot chlor. Syrup pot chlor is nothing but potassium chloride only, which is a supplement of potassium which can be taken orally, जिससे भी पोटेशियम का लेवल जो है वो मेंटेन हो जाएगा. And then if a person has moderate to severe hypokalemia, you have to give the supplement in the form of injection KCl. The person will be getting injection KCl, but the main thing you have to remember is injection KCl should never be given direct push. You have to always give it by the infusion only. And usually जब भी आप KCl देते हो पेशेंट को इंजेक्शन के फॉर्म में, you have to make sure that the person is under cardiac monitoring and the ECG monitoring. This is how you'll be managing the hypokalemia. Now we'll be starting with the hyperkalemia. Hyperkalemia में क्या होगा? The potassium level in the blood will be more. कितना more? There will be increase in the potassium level of more than potassium blood level of more than 5.2 millimole per liter. इसमें भी हमारे पास क्लासिफिकेशन है, like you have mild hyperkalemia, moderate hyperkalemia and severe hyperkalemia. In mild hyperkalemia, the potassium level ranges between 5.3 to 6.0 millimole per liter. In moderate hyperkalemia, the potassium level might be between 6 to 6.9 millimole per liter. And in severe hyperkalemia, the person might be having potassium level of equal to or more than 7 millimole per liter. इसमें भी क्या होगा? Depending on the grading, depending on the severity, there will be prominency of the ECG findings. So, which all findings will be there? There can be a peaked T wave. हमने वहां देखा था, the person might be having a flat or inverted T wave, but in the hyperkalemia, the person might be having a peaked T wave. They can be widening of the P wave or फ्लैटनिंग ऑफ द पी वेव, है ना. हाइपो में क्या था, आपके पास एम्पलीट्यूड बढ़ जाता था पी वेव का, बट हाइपर में क्या है, पी वेव वाइडन हो जाएगा या फ्लैट हो जाएगा, एंड अगेन दे विल बी द पी आर प्रोलॉन्गेशन. Along with the hyperkalemia, there can be other arrhythmias also. The person might have the bradyarrhythmias, the arrhythmias where the heart rate is slower, like the person can have sinus bradycardia or AV block or ventricular escape rhythms or slow atrial fibrillations, or the person might be having the conduction block like fascicular blocks or the bundle branch block. I know these terms might be new for you people, but I'll try to cover each one of these arrhythmias in my subsequent videos. Then the person might also be having the QRS widening with the bizarre QRS morphology. तो QRS का जो morphology है, that might be changed and they can be the widening of the QRS. Normally QRS जो है वो narrow complex होता है and the duration is less than 0.11 seconds. But in the person who has hyperkalemia, they can be widening of QRS more than 0.11 seconds also. So let's see which all changes will be there. The person might be having a peaked T wave. They can be the presence of a wide PR interval. They can be widening of the QRS and they can be peaked T wave. And as the severity increases, even you can see the sinusoidal waves. आप देखोगे यहाँ पे P wave will be completely lost and the graph will be like a sinus wave only. So the sinusoidal waves tell that a person has hyperkalemia of high level or high degree. So, what is the management? So, again, the management will focus on three main aspects. That is, you have to stabilize the cardiac membrane, you have to shift the potassium back into the cell, and you have to remove the potassium from the body. For stabilizing the cardiac membrane, you have to provide the calcium chloride or the calcium gluconate to the person. For shifting the potassium into cells, you can provide dextrose along with the insulin, or you can provide them the nebulization with albuterol, or you can provide them the sodium bicarbonate, soda bicarbonate, NaHCO3. Then hyperkalemia है, potassium body में accumulated है, you have to remove it. How can you remove it? You can remove it with the help of the diuretics like furosemide Lasix can be given, or you can provide them the sachet of K-bine, that is your calcium polystyrene sulfonate powder, which will be helping the potassium to, which will be binding with the potassium and will be releasing it from the body. Or you can go for the sodium polystyrene sulfonate, which is Caxylate, or in severe conditions, the persons might even be requiring the hemodialysis. So again, the management will depend on the severity of hyperkalemia. So just remember, if a person is having potassium imbalances in the blood, they can be push or pull effect. Push का मतलब क्या है, आप press कर रहे हो. So here you will see in hypokalemia, it will look like the T wave has been pushed. So there will be T wave inversion, ST depression, and the prominent U wave. In case of hypokalemia, it is giving you the impression of, it is giving you the impression of pulling. So you're pulling. It means the T wave is peaked, the P wave is flattening, and the PR is prolonged, and there is a wide QRS complex. So to summarize, if a person has hypokalemia, he can have a slightly peaked P wave, they can be prolonged PR interval, they can be ST depression, shallow T wave, or prominent U wave. If a person has hyperkalemia, there can be the presence of sine wave. In severe hyperkalemia, they can be tall T wave or peaked T wave, tall tented T wave, usually we see that, or they can be prolonged PR interval and wide and flat P wave interval. So that's it from my side. Now this is the evaluation time. I'll be asking few questions from you and you have to answer them in the chat box. So you have to enlist any 5 potassium containing food sources. बिकॉज वी हैव रेड दैट ना, अगर पेशेंट को हाइपोकैलेमिया होगा, माइल्ड हाइपोकैलेमिया होगा, तो आपको पोटेशियम रिच डाइट के लिए बोलना है। तो वो पोटेशियम रिच डाइट कहाँ से मिलेगी? यू हैव टू एनलिस्ट एनी 5 potassium containing food sources. Then the next question is, what are the ECG changes seen in the hyperkalemia? You have to write in the comment box what are the ECG changes in the hyperkalemia. Third question is, you have to describe the significant nursing role while administering injection KCL to a patient with hypokalemia. अगर आप पेशेंट को हाइपोकैलेमिया की पेशेंट को KCL दे रहे हो, इंजेक्शन KCL दे रहे हो, what is the significant thing you have to keep in mind as a nurse before you administer the injection KCL to the persons? So that's it for today. Thank you so much.